Welcome back, my students. Dr. Oogway here, and today in this video, we are going to talk about the nuclei, functions, and clinical anatomy of cerebellum. Clearly, so let's begin with the nuclei of cerebellum. What are nuclei? These are gray matter. These are gray matter, gray matter of cerebellum, and these are four pairs. These are four pairs. So let's draw the diagram to learn these four pairs of nuclei. So this is the diagram of cerebellum, clearly. So this is cerebellum, this is the lateral side, and this is the medial side. This is the medial side. Now in this cerebellum, we have four nuclei. This is the number first, this is the second, third, and the fourth. Since these are present in pairs, so similarly on the other side, we have four, 1, 2, 3, and 4. Clearly, this first nuclei is known as the dentate nucleus. Dentate. The second nucleus is known as emboliform nucleus. This third nucleus is known as the globose. This fourth nucleus is known as the fastigial nucleus. Fastigial nucleus. So these are the four nuclei of the cerebellum: dentate, emboliform, globose, and fastigial. Clearly, this can be understood from the diagram as well that's given in the BDC. This is the diagram given in the BDC, figure 6.9 A and B, positions of intracerebellar nuclei. This is the dentate nucleus, clearly. This is the emboliform, then globose nucleus and nucleus fastigii, clearly. And this is the dentate nucleus, cut section. So these are the four nuclei present in the cerebellum. These are four nuclei: dentate, then we have the emboliform, then we have the globose, and then fastigial. These can be remembered: A, B, C, D, E, F, G. Clearly, this dentate nucleus is the most lateral nucleus. And this fastigial, as you can see, dentate, it's the most lateral, and this fastigial is the most medial. Is the medial nucleus. Clear? This dentate nucleus is also the phylogenetically the newest. Phylogenetically, this is phylogenetically new, while as the fastigial nucleus is phylogenetically old. Phylogenetically old. So this is all about the nuclei of cerebellum. Now we'll move on to the functions of cerebellum. Now we have here the functions of cerebellum. Functions. Clearly, number first point is that cerebellum controls same side of body. Controls same side of body. That means its influence is ipsilateral. Ipsilateral. While as cerebrum controls opposite side of body. Opposite half of body. This statement, now what do you mean by this statement? Cerebellum, it controls same half of the body. Its influence is ipsilateral, while as cerebrum controls opposite half of the body. Clearly, this statement can be understood from an MRI given in the BDC. In this MRI, as you can see, this is the MRI, figure 6.11. A patient is told to move the fingers of the right hand. And at the same time, when the patient is moving the fingers of the right hand, an MRI of the brain is taken. This is the left side and this is the right side. This is the right cerebral hemisphere. This is the left cerebral hemisphere. This is the right cerebellar hemisphere, and this is the left cerebellar hemisphere. Clearly, when the patient is moving its right hand, The activity is seen on the left side of the motor cortex of the cerebrum, and the activity is seen in the right side of the cerebellar hemisphere. Clearly, since as the patient is moving on the right, as the patient is moving his right hand, his or her right hand, the activity is seen on the same side of the cerebellum, while as the activity is seen on the opposite side of the cerebrum. So we can say that. So we can say that cerebellum, it controls the same side because patient was moving the right hand clearly, and the activity was seen in the right cerebellar hemisphere. Cerebellar hemisphere. While as it was opposite from in the cerebrum. Clearly, patient was moving right hand, but the activity was seen on the left side of the cerebrum. Clearly, this is the number first function of the cerebellum. Number second point, cerebellum controls tone, it controls posture, it controls equilibrium, it controls movement of eyeballs. It controls movement of eyeballs. Clearly, number third, cerebellum helps in learning, spatial spatial motor skill, driving the guitar, etc. So cerebellum helps in learning spatial motor skill, and it also plays a role in cognition. Cerebellum also plays a role in cognition. Number fourth point, cerebellum, it acts as comparator. It functions as comparator. It functions as comparator. Clearly, it functions as comparator, and it receives its information. It receives information from cerebrum and spinal cord So these are the functions of the cerebellum. Sorry, tone, posture. It maintains tone, posture, equilibrium, movement of eyeballs. It helps in learning spatial motor skill. It also plays a role in cognition. Cerebellum functions as a comparator. It receives its information from cerebrum and spinal cord. Another function of cerebellum that we should know about is cerebellum coordinates voluntary movements. It coordinates voluntary movements so that these voluntary movements are smooth, balanced, and accurate. So number fifth function is that cerebellum, it coordinates voluntary movements so that these voluntary movements are so that these are smooth, balanced, and accurate. So by this we completed the functions of cerebellum. Now we will talk about its clinical anatomy. Now we have here the clinical anatomy of cerebellum. Clinical anatomy. In clinical anatomy, we will talk about the lesions. What if there is a lesion to the cerebellum? Lesion to the cerebellum. Lesion to cerebellum will result in defective speech, defective speech. It will result in truncal ataxia. It will result in nystagmus. It will result in hypotonia, decrease in tone, because cerebellum controls tone. Hypotonia, tone will decrease. Number fifth, it will result in intentional tremors. Intentional tremors. That's tremors during movement. Tremors. Clearly, it will result in a diadochokinesia. Diadochokinesia. Clearly, a patient will be unable to perform rapid alternating movements. That means like this is the supinator hand, supination and pronation. Clearly, this rapid alternating movement the patient will not be able to do that clearly because of the lesion to the cerebellum. That's a diadochokinesia. Clearly. Number seventh point, you know, there are six arteries that nurture cerebellum, or that supplies blood to the cerebellum. If there is a thrombosis to any of these six arteries, if there is a thrombosis to any of these six arteries, it will result in it will result in cerebellum cognitive affective syndrome. Clearly. So this is the clinical anatomy of the cerebellum. Lesion to the cerebellum will result in these problems, and thrombosis to any of the arteries, any of the six arteries that nurture cerebellum, will result in cerebellum cognitive affective syndrome. These lesions, I have already taught these lesions in detail in the third video of the cerebellum playlist. Go check it out if you want to. If you don't want to check it out, just remember what will be the result because of the lesion to cerebellum. Thank you very much. This concludes the fifth lecture of cerebellum, and it also concludes the cerebellum playlist. Clearly, thank you very much. Keep revising. Your Dr. Oogway here. Thank you very much.